So it's a really good question that we've raised today. I mean, health in all policies is important because we need to start to think about how we can truly tackle health inequalities. We know that at the moment, people who are more affluent, their life chances are increasing. In our more disadvantaged communities, it's going in the wrong direction. So we've all got to work together through a systems approach to make sure that whatever we do, whether I'm a planning officer, a public health officer, I'm in housing, I'm in transport, whatever I'm doing, I'm working in the community as a volunteer, that I understand that my contribution will be efficient and effective and help to improve the outcomes for local people. So, in my opinion, the biggest impact that we can have on health inequalities is by taking a life course approach. We've got to start with early years. We've got to empower our parents and the parents of the future to look after their children, to nurture them, and the children themselves, to inspire them, to give them the opportunity to achieve whatever they're going to achieve, but at least make that an even and a flat as playing field as we can. So if we start with that, we invest in our early years approach, we nurture our young ones through that, and then we support older folk as well, because once we've done our bit, we've done our innings, we've all still got a productive life to lead, so that at the end of our lives we've got a life that's as free as possible from illness and morbidity, and that we can, pass out of this nice place with a smile on our face. Well, look, in my job as Director of Public Health, the only way that you can succeed is through collaboration. Of course, I've got some statutory powers, but power is nothing without influence. And the way to influence people is actually to understand where they're coming from, share your concerns, listen to their concerns, and then try to build a way forward so that you can then work with them and they can work with you, so everyone gets a win-win. Well, look, I'll tell you, today's conference has been an eye-opener for me. I came early to listen to the speakers and I heard some fantastic inputs. I'm going to go to Martin Reeves because he's a chap that knows what he's talking about, and he really did lay out the ground laws for us all. If we're going to make that difference to our population, we really have to stop talking and do more working. And I think that's the thing that I'm going to take away from today.